Here's what happened this week at City Council.
And in our report on Monday, we have seen a 74% decline in positive COVID cases since the first week of August. We've also seen a hospital and ICU admission decline as well. 1 in 4 positive cases that we are seeing are patients with no symptoms. We're also continuing to expand our testing in the community, and we now have clinical testing capability in 8 of our 9 area school districts. In our report, we also noted that the city's launched a flu prevention campaign. So we're encouraging the community to get a flu shot and be aware of the preventative measures. But now more than ever, particularly since we're heading into the traditional flu season, it's important for us not to be complacent, continue to do all the things that we know we should be doing, wearing a face covering, washing our hands, and keeping good social distancing so that we can continue to mitigate the spread of the virus and get back to normal in the community.
On Monday, we discussed item number 2 was El Paso Strong Resolution, which was passed in June of 23 by the City Council. And our goal is to look at police reform, look broadly across the organizations at opportunities to improve and increase equity, and also to look at any racial disparities that may exist within reporting that are coming out for the police department currently. For the community, it really is helping us to look at and ensure that we're providing the best possible services to our community. Our strategic goal is to provide a safe and secure city, and this certainly supports our efforts in terms of ensuring that we're safe, secure, and that we're looking for opportunities to ensure that we're measuring that and being able to report those metrics to the community in a way that makes sense and that they can understand.
Roughly 3/5 of the personal crossings are comprised by Mexican residents, and the majority of the crossings are made by Juarez's and El Pasoans. Mexican residents are more likely to come here to shop versus U.S. residents are more likely to go over there for social reasons, followed by health visits. Another main finding is when Mexican residents do spend in El Paso, about 4/5 of those visits are to some sort of retail trade establishment, versus when El Pasoans go to Juarez to make a purchase, it's about half and half between visiting some sort of retail establishment and the other half visiting for some sort of service, mainly health related or to visit restaurants. Well, we always knew that the Mexican national that comes and shops in El Paso is a big part of our economy, but we've never had any systematic data to tell us how much they were spending. And in short, this quantifies who visits, why they visit, and if they're spending, how much they're spending.
What we were discussing was ordinance for the Building Standards Commission, which is Chapter 2.38 in the Municipal Code. That particular code has not been updated in quite a long time. Basically, the bottom line is currently there's Panel A, Panel B, and an alternate panel. Each one is 9 members, which consists of 27 total members of the Building Standards Commission. The request to council is to revise this ordinance to create only 1 panel. And that's what we're asking for the Building Standards Commission to be a panel of 9 members. So what this means to you, the community, that we will be bringing back an ordinance as a first reading and a second reading so that we can get the official approval to proceed. And so we will be moving ahead to bring this back.
Items 21.1 and 21.2 at yesterday's council meeting are really important to this community, and they did a couple of things. We amended the annual action plans for our CARES funding and for our regular entitlement. Why is that meaningful to the community? Because it means that our organization is being very agile and responding to the needs of the community as this pandemic progresses and as we better understand what the needs of our community are. So the action yesterday funded 2 brand new programs, a Veterans Permanent Supportive Housing Program, as well as a COVID-19 Family Resilience Center with the United Way. So a lot of activity, but a lot of support for the community. In the last 3 months, $26.2 million have been allocated to community support.